Good day. We will now discuss Health2000 syringes. What are syringes? Syringes and needles are sterile devices used to inject solutions into, or withdraw secretions from the body. A syringe is a calibrated glass or plastic cylinder with a plunger at one end, and an opening that attaches to a needle. The needle is a hollow metal tube with a pointed tip. A syringe and needle assembly is used to administer drugs when a small amount of fluid is to be injected. When a person cannot take the drug by mouth, or when the drug would be destroyed by digestive secretions. A syringe and needle may also be used to withdraw various types of body fluids, most commonly tissue fluid from swollen joints or blood from veins. The modern hypodermic needle was invented in 1853 by Alexander Wood, a Scottish physician, and independently in the same year by Charles Provaz, a French surgeon. As of 2003, there are many different types and sizes of syringes used for a variety of purposes. Syringe sizes may vary from 0.25 ml to 450 ml, and can be made from glass or assorted plastics. Latex-free syringes eliminate the exposure of healthcare professionals and patients to allergens to which they may be sensitive. The most common type of syringe is the piston syringe. Pen, cartridge, and dispensing syringes are also extensively used. One common type of syringe consists of a hollow barrel with a piston at one end and a nozzle at the other end that connects to a needle. Other syringes have a needle already attached. These devices are often used for subcutaneous injections of insulin and are single-use. Syringes have markings etched or printed on their sides, showing the graduations for accurate dispensing of drugs or removal of body fluids. Cartridge syringes are intended for multiple uses, and are often sold in kits containing a pre-filled drug cartridge with the needle inserted into the piston syringe. Syringes may also have anti-needle stick features, as well as positive stops that prevent accidental pullouts. There are three types of nozzles. Luer lock, which locks the needle onto the nozzle of the syringe. Slip tip, which secures the needle by compressing the slightly tapered hub onto the syringe nozzle. Eccentric, which secures with a connection that is almost flush with the side of the syringe. A hypodermic needle is a hollow metal tube, usually made of stainless steel and sharpened at one end. It has a female connection at one end, that fits into the male connection of a syringe, or intravascular administration set. The size of the diameter of the needle ranges from the largest gauge, which is 13, to the smallest, that is 27. The length of the needle ranges from 3.5 inches or 8 centimeters for the 13 gauge, to 0.25 inch or 0.6 centimeter for the 27 gauge. The needle consists of a hub, with a female connection at one end that attaches to the syringe. The bevel, which is a slanted opening on one side of the needle tip, is located at the other end. Needles are almost always disposable. Reusable needle assemblies are available for home use. Fluids can be injected by intradermal injection, subcutaneous injection, intramuscular injection, or Z-track injection. For all types of injections, the size of syringe should be chosen based on the amount of fluid being delivered. The gauge and length of needle should be chosen based on the size of the patient and type of medication. A needle with a larger gauge may be chosen for drawing up the medication into the syringe, and a smaller gauge needle used to replace the larger one for administering the injection. proper procedures for infection control should be strictly followed for all injections. The available types of syringes in our inventory are a syringe without needle or luer lock type, catheter tip, insulin, and tuberculin syringes. One must note the volume needed. It could be 3 milliliters, 5, 10, 20, 30, 50, or 60 milliliters. Next is the type of tip. We also have syringes with needles. Determine the gauge or diameter of the needle. The higher the number, the smaller the diameter, such as gauge 18, 20, and 22. Next note is the length of the needle. It can be ½ inch, 3/4 of an inch, or 1 inch and even 5/8 of an inch. Just take note of the specifications, and you're on your way to provide the best syringe a hospital needs. The insulin syringe can be sold at pharmacies or drugstores, since diabetic patients usually are the one who does the injecting already. This picture shows the parts of the needle and the other types of syringes. An asepto syringe is a syringe designed to fit directly into large lumen tubing, also used for intraoperative irrigation. The bulb syringe is used for gentle suction of small amounts of bodily drainage, such as oral and nasal secretions. It can also be used for intraoperative irrigation. The hypodermic syringe is for introduction of liquids through a hollow needle into subcutaneous tissues. So, welcome to the world of syringes, where there is never-ending use and never-ending sales and profit. And happy selling!